in the 90s, there was a scandal in the United Kingdom because the Bristol Royal Infirmary had a paediatric surgical unit, and they were doing an operation called the arterial switch, which was in kids with congenital heart disease, swapping the aorta and pulmonary artery around. I mean, it's sort of quite hairy surgery. But the mortality rate in the Bristol Royal Infirmary was terrible. And there was an anaesthetist, whose name escapes me, Steve Bolson, who blew the whistle and no one believed him. You know, it's a little bit like the case of Lucy Letby, the murdering the neonates that the administration wouldn't believe, and whatever. And eventually it turned out she was a mass murderer. But not that these surgeons in Bristol were trying to be mass murderers, but no one would believe Steve Bolson. But eventually someone did an external review and suddenly, wow, this is what's happening. Bolson suffered so badly from this that he actually left England and came and worked in Australia. And he went and became an anaesthetist in Barwon Health, and he's now a quality control person in a private hospital in WA. So it's been quite a journey for him. But the rules were changed in the United Kingdom as a result of all of this and certain standards and whatever. But out of it, a British human factors expert, James Reason, decided that they would study this operation done in other parts of the United Kingdom and see if they could establish patterns or markers of success. And this was done by, so 2 human factors experts would sit in the operating theatres in paediatric cardiac units in the United Kingdom, and their findings were quite remarkable because they were able to identify behavioural markers of surgical excellence, an often a not well understood field at all. Technical skill was one of them. Well, hardly surprising. That's seems fairly obvious and self-explanatory, but the rest of it not necessarily so. Mental readiness, cognitive flexibility, in other words, in a complex situation, being able to perform and solve problems and find a way out of a difficult situation. Anticipation, understanding where things might go wrong, how they might go wrong, and being prepared for that. Safety awareness. And that's more than just the bit in front of you, that's the whole operating theatre. Communication style, how they would talk to. Now, none of you've had much opportunity to be in operating theatres yet, but there is a thing in sport called white line fever. People step over into the arena and suddenly become different people. You see it in operating theatres. Some surgeons behave incredibly badly in operating theatres, completely lose the plot. Yell, scream, rant, rave, throw stuff, whatever. Whereas others remain calm and communicate with people on a more egalitarian basis. And what they discovered here is that makes a difference. Team adaptation, in other words, including people and developing a team stuff, situational awareness, understanding what's going on around you and making adaptations for that. Now, 4 of the 16 surgeons studied performed at a higher level when measured with these performed better in terms of outcome, morbidity and mortality, and they all rated highly on the behavioural indices, which was the first study I've ever seen that did this. They made fewer errors, more compensations, highly adaptive to unplanned departures, and tended not to show stress. In other words, kept control and kept calm so that people around them kept calm. Whereas the lesser performing surgeons also rated consistently across the behavioural characteristics, but less well. Less likely to make compensations, did not generate new hypotheses to solve problems, had or developed cognitive tunnel vision and fixation errors, continuing to try and do it the same way and expecting to see a difference. So that's sort of a fairly remarkable study in a whole lot of ways. Interestingly, the hospitals in which the 4 high-performing surgeons worked prioritised clinical over non-clinical goals. So there was an institutional component to all of this as well. And I think we're in great danger in healthcare of losing that perspective. There were negative effects of team and organisation as well. No team stability, inexperienced junior staff, rotating scrub nurses, disruptions to the flow of operations. And what they discovered was if there were 7 minor events, suddenly the team was unable to adapt, that there was a drip, drip, drip effect, and the team performance and surgeon performance deteriorated significantly, which is also a really interesting thing. I've added 2 more factors onto here, humility and self-awareness. I do go into a little bit more detail in this in a talk I do on human factors, but just to complete the ones. Now,